I am Ala Alwan, the Regional Director for the Eastern Mediterranean region, the World Health Organization, and I'm very pleased to provide an outline of our own experience in helping countries to expand capacity in public health with special emphasis on essential public health functions. The initiative is based on an in-depth review of the health situation and the challenges that face health development in the Eastern Mediterranean region. This in-depth review was conducted at the beginning of my term as Regional Director in early 2012. And the review identified 5 key priorities that should be the focus of public health action over the 5-year period. One important conclusion of the review process was the pressing need to expand capacity in public health with special focus on ministries of health and other components of the national health system. To me, investing in building capacity in public health is top priority. I first joined WHO in this region more than 20 years ago, and I was obviously working very closely with ministries of health. Coming back as Regional Director more than 15 years later, I noted with concern that in many member states, the capacity of public health has not improved significantly, and the gaps that exist are impeding progress in addressing public health challenges. I was therefore considering concrete ways of addressing these gaps. At the same time, and as an outcome of this review, some member states expressed deep interest in conducting an assessment of the essential public health functions and their own capacity to implement them. The review was conducted jointly with member states, and they endorsed these 5 key priorities. They are health system strengthening with an overarching goal of universal health coverage, maternal and child health, health security and communicable diseases, non-communicable diseases, and emergency preparedness and response. The outcome of the 2012 review was documented in a publication on shaping the future of health in the region and reinforcing the role of WHO. During the 5th year of my term, an updated version discussed with member states in May and October focused on the progress made in addressing the 5 key priorities and in strengthening public health response. A number of regional initiatives were established in 2012 to strengthen the regional capacity of public health. On top of these initiatives is the work on essential public health functions, which is the focus of this presentation. But in parallel, we also established the Leadership for Health program, which has been conducted jointly with the Harvard School of Public Health to prepare public health leaders in the region, and the Health Diplomacy Initiative, which is an annual activity involving leaders from health, foreign affairs, and parliament, as well as strengthening public health skills and presence in country offices. We have also refocused the Eastern Mediterranean Health Journal on public health to serve as the regional public health journal. We also took some initiatives to promote the networking and joint work with public health institutions and public health associations in the region. Let me now focus on essential public health functions. One definition of these functions is that they are an indispensable set of actions under the primary responsibility of the state that are fundamental for achieving the goal of public health, which is to improve, promote, protect, and restore the health of the population through collective action. So the basic aim of this initiative that started in 2013 was to assist countries in assessing and building up public health capacity by conducting an objective assessment of essential public health functions to identify strengths and weaknesses in public health capacity, as well as highlighting areas that require improvement. The objective is also to provide best advice for addressing weaknesses and improving performance. The key questions answered by the assessment will have to include: how is the function carried out? What agency has the main responsibility? What is the capacity to perform this function? And finally, what needs to improve? These are the milestones for the development of the initiative. We started by forming a network of experts who are already engaged or interested in the development of essential public health functions, by reviewing the experience of other WHO regions, mainly the European, American, and Western Pacific regions. And we also wanted to ensure that we look at the experience of other partners like the CDC, the World Bank, and also EMPHE. We had a series of technical meetings aiming to develop a methodology, an operational framework that can be adopted regionally, and also a basic assessment tool building on international experience. Then we moved into a pilot phase, which was conducted in Qatar, thanks to the vision of the national health authorities in Qatar, followed by another pilot in a French-speaking country in the region, which is Morocco. We then reviewed the two experiences, highlighting the lessons learned before implementation in other countries. Analyzing the experiences of the other regions was extremely useful to us. We eventually came up with a framework of essential public health functions that is basically or essentially consistent with other experiences, but with somewhat different wording, taking into consideration the health priorities in the region, and in a way that simplifies but also consolidates the structure of public health functions and reduces as much as possible overlaps. We can see here the different structures ranging from 11 to 10 to 9, and in our own version, 8 basic public health functions. But as I said, the contents are more or less the same. The conceptual framework of essential public health functions in the region identifies 8 interrelated functions which should form the basic components of a comprehensive national health systems. Operational definitions were developed for each one of them, and each function is broken down into sub-functions which collectively form a comprehensive package of public health services that each country should aim to provide to their own populations. And the 8 functions can be conceptually divided into 4 core essential public health functions and 4 enabling functions. So a great deal of the discussion took place on whether or not curative or clinical health services should also be included. So the core essential public health functions include surveillance, preparedness and public health response to disease outbreaks, natural disasters and other emergencies, health protection including management of environmental, food, toxicological and occupational safety, and health promotion and disease prevention through population and personalized interventions, including action to address social determinants and health inequity. The enabling essential public health functions include assuring effective health governance, public health legislation, financing and institutional structures, which is the stewardship function, assuring a sufficient and competent workforce for effective public health delivery, supporting communications and social mobilization for health, and fourthly, advancing public health research to inform and influence policy and practice. This is a snapshot which shows the structure of the third function, which includes the operational definition and the scope of function. So this is another example from Essential Public Health Function 2. It's a snapshot of one section of the tool. And you will see that some of the sections include a yes or no answer, whereas other sections require a more detailed response. Let's now look at the approach and the basic elements of the assessment. As prerequisites, a successful assessment requires the process to be countrywide, country-led, with multi-sectoral engagement. This is important because we know that in each of the 5 key priorities in our own region, very little difference is made unless multi-sectoral engagement takes place. The assessment has to be comprehensive. It has to include all parts of the health system involving all health partners in the country. It has to identify areas of strength and areas for development, and it proposes recommendations to address the identified gaps. So building capacity to undertake the assessment is a major element of the process. So let's now look at the pathways for assessing essential public health functions. Firstly, WHO already has considerable experience based on many years of technical collaboration. The desk review provides a preliminary assessment of strengths and weaknesses and areas requiring development according to the views of the WHO technical staff and managers. Then the national assessment using the tool, and in this case the tool is provided to the Ministry of Health and it is given to different departments responsible for the different public health functions so that they can respond to the questionnaire of the tool and then through a national meeting produce their own conclusions on their capacity, and these conclusions are shared with WHO. Now the third pathway is an independent assessment by a team of WHO staff and experts. The group reviews the outcome of the first two pathways and develop their own assessment based on interviews with health and with relevant non-health stakeholders. And a final high-level meeting of the expert group with the National Health Authority takes place to discuss their preliminary impressions. Let's now look at the process, and this slide summarizes the process that has been adopted, starting with a declared interest and request from member states. Then a national team is assembled. Then WHO shares the tools and the methodologies to the national team. And then we move into the national team using WHO tools to conduct a national assessment, which is a self-assessment. Then WHO gathering all relevant WHO and national documents and reports. And then we move into the team of international experts undertaking a mission to the country. We then have a preliminary report which is drafted and shared with the national team, and then discussion and consensus on the results and the recommendations. And finally, of course, a national workshop to develop an action plan based on the recommendation. So the two member state assessments carried out so far include, as I mentioned before, Qatar and Morocco. So the Qatar mission was conducted in March 2014. It was guided by the Supreme Council of Health in Qatar, which is now replaced by the Ministry of Health. And it was very timely with the development of the new public health strategy. In Morocco, the assessment was conducted in November 2014, was guided by the Ministry of Health, and it was also timely with the development of the health sector reform process. There were a number of common recommendations, as you can see here in this slide: strengthening intersectoral collaboration and health in all policies, considering organizational structure of the Ministry of Health and the financing arrangements, strengthening institutional capacity through a national public health institute, and strengthening human resources capacity in public health. But there were also some specific key gaps identified, and you can see some examples of these gaps in this slide: weak integrated and risk factor surveillance systems, the scarcity, maldistribution, and reliance on expatriate public health workforce, inadequate public health financing capacity, insufficient health protection legislation and enforcement capacity, the absence of multi-sectoral and cross-disciplinary public health emergency preparedness plan, and all these gaps are detailed in the final report. We conducted a review of our experience in the two countries in 2015, and we came up with a number of important lessons learned that have to be taken into consideration when we conduct the assessment in other countries. And these lessons learned include a number of important points in relation to the approach, the assessment process, and the assessment tool. And one of the lessons learned is that the combined approach is very useful and it contributes to ensuring an unbiased final product. The fact that we conduct a self-assessment by the national staff, followed by independent assessment, and then a combined effort to reach the conclusion. The second important lesson learned is that the WHO preparatory work to collect information is absolutely vital in assessing the situation prior to the visit, and that the external visit is considered sometimes too short unless an adequate national assessment is conducted before. On the assessment process, we find it extremely helpful if it is done at the right time in the country's planning cycle. And it always brings together different sectors and stakeholders at the national level. On the assessment tool, we find that the tool is very comprehensive. However, a shortened version may be necessary for countries where a complete assessment cannot be conducted. And the norm for each function needs to be explained in terms of the ideal system. There is also a need to identify issues that are core and then identify what is optimal. This slide shows the challenges and opportunities, and obviously there are a number of challenges. So I will not go into detail about these challenges and how to address these challenges, but I hope that we will be able to cover this during the discussion. And finally, let me finish with a final message. I believe that assisting countries to assess their public health capacity is at the core of WHO's work. This is one of the basic functions of WHO, and that is why it was regarded as one of our top priorities when we started our initiative in 2013. It is not an optional activity. It is not an isolated initiative. Assessment of essential public health functions and addressing the existing gaps is the basis of our collaboration with countries and is an essential prerequisite for any difference the country will make in tackling their challenges. Thank you.